this technique called Diamond Technique. And as you can see on this diagram, the main points, it is the projection of the main retaining ligaments, or it will be correctly to say it is the projection of retinaculum cutis, the terminal part of the retaining ligaments. So in that cases, like on this diagram, we make boluses or papulas, 0.1, and after that we combine them by lines in linear retrograde technique. You should know that we must work in the dermis. Our level of injection must be dermis, and the points, the entry points must be boluses or papulas, and the linears must be in linear retrograde technique. So the product will be Xela Rederm 2.2, the 2 milliliters, 2 cc, 1 milliliter, 1 cc on the one side, and 1 milliliter on the next side. It's very good technique. It shows very good results of lifting because we stimulate collagen in the points of projection of the retaining ligaments, and we get lifting effect. We need to do, for good and long result, we need to do 3 sessions, and the breaks before these sessions must be 3 weeks, 2 or 3 weeks. After that, you will get a good result. The lifting effect your patient will see after procedure, but it will be only 10 or 15% of the final result. Final result of procedure you can your patient will get after 2 weeks, after first sessions. So in some first good results your patient will get after first sessions, but this result will be not so long, maybe a few months, maybe 2 or 3 months. If you want to have results for 1 year, you need to do 3 sessions of this procedure. On the practical part of our today's webinar, you will see this technique and you will understand everything as I see. And here are my contacts. You can follow me on Facebook or in Instagram, and you can write me maybe some questions that are you interested in, and you can do it here. So, and after that, I would like to present you the video demonstration of this technique. Okay. So we will use the product Xela Rederm 2.2, 2 milliliters. First of all, sure, we need to clean the skin of our patient. After that, you need to put topical anesthesia because procedure is a little bit painful. I use for this procedure only needle. I don't use cannula for this procedure because if you use cannula, you don't be in dermis. So 5 points. First point is the middle part of zygomaticus arch. Second point, it is the middle part of nasolabial fold. Third point, it will be the notch of mandibula. The next point, it will be the mandibular border. And the last point, it will be the near tragus of the ear. After that, I do linears and combine all points. After that, I make the middle point in the middle part of my diamond, because technique is called diamond, and I do all linears to the center. So I started the middle part of zygomaticus arch. I do first popular 0.1, the middle part of nasolabial fold also 0.1, the notch of mandibula 0.1, the mandibular angle 0.1, and the tragus of the ear 0.1. After that, I do the middle point, and after that, in linear retrograde technique, I do the nails, and I'm going from the first point to the second point. So these points are in dermis. Yes, all our injection must be in dermis, because only in dermis we have the projection of our retaining ligaments, and we need to stimulate them only in dermis. After that, I do from my second point, from the middle part of nasolabial fold to the notch of mandibula, our third point. Also, this linear injection I do in dermis. I need to see the conturation of my product on the skin. When will you repeat this webinar? Maybe next time I will see and hear. I think that you will get the recording of this webinar on your email, or on your mail. After that, I do the next from the zygomaticus notch to the angle of the mandibula. And my last linear from the middle part of zygomaticus arch to the point near the tragus of the ear. As you can see, it's a good reaction of the patient. It's not unpainful procedure, but patient's reaction is normal. And after that, from the center point, I'm going to both points that I have, from the center to the point of the middle part of zygomaticus arch. It is possible to do this part with a micro cannula. I think it's not possible. Why? Because when you use micro cannula, you will be a little bit deeper, maybe in the subcutaneous fat. And the products don't work on this level. We must be in dermis. The most controlling technique to be in dermis is with the using of the needle. So this technique working only with the needle using. I was trying to use cannula, micro cannula, for these injections, and I don't get such good results which I get with the using of the needle. I couldn't see the video. you will get the record of this webinar. How long lasts the marking of injection? In a few days, in 1 or 2 days, it depends of the patient, on the skin, the patient, and us. And on the other side, I do the same technique. First of all, you need to see your needle when you inject, and you need to see the conturation of the products. If you see conturation, it means that you are on the right level of injection, you are in dermis,